We all say and know that we need to do things to improve the patient's experience, but just telling people to do that is not going to enable them to do it.
We've heard things that have been difficult to hear about services, but we needed to hear them, and things needed to change in some areas of the service, and we shouldn't be put off from hearing that.
As an ICU patient, Margaret was predominantly unresponsive to verbal stimuli or requests from staff such as, "Can you open your eyes for us?" or "Can you open your mouth so I can give you some medication?" Several days after she was admitted, a family member told staff that Margaret actually goes by the name Maggie. As soon as the care team stopped using her formal name, Maggie became more receptive. This was one of the first steps towards Maggie's full recovery.
Hi, my name is Victor Bajan, and what I've discovered is that when the personal idiosyncrasies of a patient are not only communicated, but also used to consider their delivery of care, it results in a more empathetic and personalised, but also more economic service of healthcare for users and providers.
Over 12 months, I have collaborated with hospital staff and inpatients at Austin Health to develop a tool to capture this kind of clinical and non-clinical information that currently has no formal way of being communicated. I ran workshops with staff and patients to evaluate existing communication boards and understand their opinions towards a new board's content. It's imperative that patients not only know where Combi is, but also have easy access to it. One patient that I talked to had been in the same room for a few months and had never noticed the patient feedback poster behind his head. Combi operates in the patient's space without being obtrusive. Through the use of magnets, patients have the option to display it on their meal table, stow it on the leg of their table, or mount it behind them as they prefer. Combi's freestanding design doubles the graphic real estate of the board. This allowed for the front side of the board to be used for personal information. Prompts include a space for patients to write questions they want to remember and who their support team is, amongst other things, while the back enables patients to communicate their healthcare goals and preferences of care. Combi aims to facilitate three-way communication between hospital staff, inpatients, and their family members and friends. Combi can easily be broken down so that any of its components can be replaced or cleaned with hospital-grade cleaning agents. Combi's mounting system is contoured so that the stand securely fits and locks into position, resisting knocks and bumps. Collaborative development was at the center of this project. This meant that as the designer, I facilitated staff and patient involvement during research and development. Without the collective knowledge base of staff and patients driving the design decisions and project outcomes, Combi would not have been as well equipped to deliver a resolved user experience. The project has been trialled in 3 wards across the Austin facility, with feedback being collected from both patients and staff. This feedback will be translated into a refined design solution and has the potential to be implemented across the whole Austin facility in 2017. This means that in just 1 year, Combi could impact the experience of 100,000 patients, and that Margaret will always be called Maggie during her time at Austin.
For me, it was about patients, relatives and staff working together, identifying together and learning to work together too towards an end product.